One of the other things in hospice care, people think once they're on hospice, they can't go to the hospital anymore. So let's say we know somebody who's on a hospice program and they fall down and they hurt their knee or their hip or they bang their head. They need a trip to the hospital, don't they? Might need stitches, might need surgery. That's not what we're talking about when we talk about not going back to the hospital. When you come on hospice, you have a terminal diagnosis. So what we do then is start treating you in your home for that terminal diagnosis. If something comes up and you're feeling uncomfortable, or let's say there's something wrong with your lungs for your diagnosis and you can't breathe well, that's what our hospice nurses are trained in. Our medical director, some of you might know him, Dr. Dick Camps. He's been in our community for a long, long time. He's a general surgeon actually, but he is our medical director for our hospice program and has been for a number of years. So he is available to our nurses for consultation. For our hospice patients, when they need a home visit, Dr. Camps is available to do that as well, depending on what their needs are. So most people who are on hospice care don't want another trip back to the hospital anyway. But what I want you to understand today is that we don't prevent you from doing that. But typically in whatever you come on the hospice program for, your hospice diagnosis we call it, that's something we're going to help you treat at home if we can. In your hospice experience, you just said that you had 2 of them, and that might be very similar for you too, what you're finding. So let me ask you this. When you think about hospice care, is there something that you would like to address? Is there something that you're thinking when you think the word hospice that you'd like to talk about today? Anything? No? Are you fearful when you hear the word hospice? No? And you know, I love to hear that, because that is something that is our goal as hospice providers, is to have people be able to think about hospice, to talk about hospice, to engage in conversations about something that's as natural as giving birth. You know, hospice allows us to really face our end of life and allow a natural process to happen, and to do so comfortably. Hospice has been around in the United States for about 50 years, and it came from England, actually. And it's kind of changed over time, but has developed to something that most of our insurance companies actually recognize as a specialty in healthcare today. So when you hear the word hospice, I hope you'll think of Mercy Health Visiting Nurse Services. The other thing is, if you just want to know more about it, let's say you know somebody who might be entering that phase of life and need to just have some information about it, we're happy to come to their home or meet them for a cup of coffee somewhere and just talk to them about what the program is and what that can mean to them as a family and as an individual. So let me just quick take a peek here and make sure. A couple more things quick before we wrap up. What we hear most of all from people who have used our hospice service and I don't know anything about your personal situation, but what we hear most often after the fact is, I wish we would have called sooner. We needed hospice a long time ago, and we didn't get into your program, or we didn't get referred to your hospice program until very late. And we hear that all the time. Once you get involved with your hospice team, it's really something that becomes a part of your daily process. It's something that you are able to engage with your social worker or your pastor who comes. Our pastor actually coordinates with our community pastors, because most people that we serve on hospice, not all of them, already have a community pastor. They have a church that they've gone to for many, many years, or one that maybe they've not been able to get out to for a period of time, but you still have a connection with the pastor at that church. So our hospice pastor connects with your pastor, and he or she then would work with our hospice program and with our hospice pastor to serve you during that time and to serve your family during that time. What we find in hospice also with earlier referral, we talked a little bit about the fact that sometimes people can actually live longer when they're on a hospice program for a longer period of time. Medicare recognizes it as something that you can be referred for 6 months or longer on the program. It's not something that comes just with the last week of life or with the last 2 weeks of life. Well, look, you know what? You're right on some accounts. What 2 physicians have to say in order for someone to come on to hospice care, 2 physicians have to say that there is a disease process happening with someone that would likely cause the end of their life within a 6-month time frame. Now, does that mean people always pass away within that 6-month time frame? It doesn't. Some, unfortunately, go sooner because we can't always accurately predict. Some, however, live longer than that. And as long as at the end of that 6-month window, we can look at an individual and say, yes, they still do qualify for hospice care, then we can do what's in the technical term called recertification. And that means we can continue for another few months and take a look at that again. And then they allow us to take a look at it again. So, and that will continue until the person usually passes. Now, we've had hospice graduates. What does that mean? People who come onto hospice care who actually get better for a period of time, and they have to go off the hospice program because they don't qualify anymore. So that also can happen.